This presentation is a physiological approach to a penile venous stripping surgical procedure for patients with erectile dysfunction. This report is based on the clinical research and historical data collected by Dr. Geng-Long Hsu, the head of the Micro-Potency Reconstruction and Research Center for Hsu's Andrology in Taipei, Taiwan, and also a practicing surgeon at the National Taiwan University Hospital, Jinshan Branch, New Taipei City, Taiwan. Also, Dr. Geng-Xing Jie of the Buddhist Tzu-Chi General Hospital, Taipei Branch, Taipei, Taiwan, and Dr. Shenjian Huang of the National Taiwan University Hospital, Jinshan Branch, New Taipei City in Taiwan. In 1902, Dr. Wooten made the first dorsal penile vein ligation for atonic impotence. Although Dr. Lousley had also reported this procedure in men in 1953, dorsal penile vein ligation actually for restoring erectile function was not popular until 1985. In light of the disappointing results, as well as the unavoidable complications of such procedures, it was determined in 1996 by the Urological Association of America and also published in its guidelines that venous and arterial surgeries for treating erectile dysfunction were not justified in routine use. Subsequently, the procedures have been almost entirely abandoned worldwide. However, since 1986, new research has produced many new insights into penile tunicle, as well as venous surgery and erection physiology. This research has inspired continued clinical application of penile venous stripping surgery. Perhaps this was the only uniquely viable option for nature. After rigorous anatomical studies and intensive microsurgical training using a laboratory rat and key instruments, a new way of performing penile venous stripping surgery was developed chronologically by Dr. Hsu. The entire surgery is finished in such a way as to respect the delicate nature of the penile tissues. The new methods we have developed minimize tissue damage by foregoing previously used techniques such as the suction apparatus and electrocautery. All procedures are performed on a true outpatient basis under pure local anesthesia. This advanced method, which is contingent with a physiological approach, was granted a patent on August 14, 2012 by the United States Patent Office. Here we're able to see the differences in our anatomy blueprint versus the conventional anatomy of the deep dorsal vein. 1, you see the tunica albuginea. 2, the distal ligament. 3, the incomplete septum. 4, the cavernosal vein. 5, the paraarterial vein. 6, the intracavernosal pillars. With acupuncture assistance, we found that pure local anesthesia patients were able to return to their work activities immediately after surgery. A 0.8% xylocaine solution pre-rinsed with epinephrine was injected via a 10 millimeter syringe. The dosage is limited to 400 milligrams. The acupoints that are routinely chosen are the Hegu Shosanlin, the Kei-Chi, the Waiguan, or the Neiguan. On the left, we can see surface anatomy of acupoints. On the right, we see the application of needles above, and we have found that even acupuncture on Hegu is helpful at this time. We see here the chronological penile venous stripping procedure. In photo A, we see the circumcision incision being made. Photo B shows us the deep dorsal vein trunk as the corpora cavernosa is squeezed. In C, we see the opening on the buccal fascia at the exit of the emissary veins. D shows the pull-through maneuver. In photo E, we can see the pubic medium longitudinal incision. In F, we are managing the deep-seated veins. Photo G shows the venous stripping, which is performed until the infrapubic angle is reached. Finally, in photo H, the circumferential and pubic wounds are closed. Here we see the cavernosogram for before and after penile venous stripping surgery. In A and B, we see the earlier phase cavernosogram before penile venous stripping surgery. You can see the veins are shown. Photo B is a later phase film. Photo C shows us the condition after the penile venous stripping surgery as compared with film A. Photo D is compared with film B after the penile venous stripping surgery. This advanced method was granted a patent from the United States Patent Office, so it might be good for most men that are suffering from erectile dysfunction. We know that venous-occlusive dysfunction is the major cause of erectile dysfunction. The penile veins are the principal component in erectile rigidity. This slide shows the results of our research on defrosted human cadavers with regard to penile venous stripping. The film shows a worsening condition for some patients after their surgery. We believe electrocautery is likely the cause for a worsening condition in so many men after they underwent surgery for erectile dysfunction in other countries of the world. Photo 1 shows the surface burn caused by electrocautery. Photo 2 and 3 show that the sinusoidal wall was also burned. If you are a specialist, a urologist, a vascular surgeon, or a plastic surgeon with a good command of microsurgical technique and are interested in observing our surgical techniques in our practice, we are most happy to extend to you an invitation to attend and observe any number of these operations. We have a fully equipped laboratory staffed with a team of professionals trained in microsurgery, which has been valid at the National Taiwan University since November 2011. If you are a patient and currently suffering from a form of erectile dysfunction that is proven unresponsive to conventional medical solutions, we encourage you to consult with us before you do anything else. All of our procedures have been proven safe. They are performed on an outpatient basis. Local anesthesia is used in all cases and can be augmented via an initial application of acupuncture. We welcome any and all specialists and patients who are interested in exploring these techniques. We believe if, as a specialist, you can take the time to come and observe it, it will expand your knowledge in this field. And as they say, seeing is believing. And for the student, remember, experience is truly the greatest teacher. Thank you for your attention and your attendance today.